Hey everybody, Dr. T. It's been a while since I've been on, so I just wanted to check in and let you know that here in Texas we are still open. We're still doing things, maybe a little bit more controlled, I suppose. I think maybe gatherings got a little bit big there, and that's maybe why we're having so many spikes in cases. Positive tests, should I say, not necessarily translating into deaths, but the city of El Paso did try to shut down or lock down, and the governor said no. So we still have a democracy here in Texas. Reason I'm on is because I wanted to let you know that telemedicine visits are still available, and I do take most of the major insurance plans. So if you do want to do a telemedicine visit, you do want your insurance to coverage because you're paying a lot in medical insurance every month, then give my office a call and we'll get you in. We can order labs. I can do labs. I can do a nice, concise yet very thorough plan. So we're still here, still seeing patients, still doing everything I've always done. Elective surgeries are still on. Essure removals, fibroid cases like excessa, things like endometriosis, hormonal management of endometriosis or excessa or fibroids. All of those cases are still ongoing, and because it's the end of the year and you might have a lot of your deductible already met, if something was kind of up in the air, like you were thinking about having those coils removed, or you do have some big symptomatic or even small symptomatic fibroids that you would like a second opinion on, try to get in and use what you have already paid for with your insurance. But elective surgeries are still going here in Texas safely. The facility that I work out of here in Texas is COVID free. We have not had one COVID patient in the surgical hospital where I operate, so it's very safe. Anybody that's getting surgery actually has to be tested for COVID. And so we know that this is currently probably one of the only COVID-free facilities in the United States. So everything is done with your best interest at heart. Obviously, it's the end of the year, so with deductibles being met, the schedule's fairly full, but I'm putting on some extra days for people that really want to get things done so that they can start 2020. Hopefully we can all start 2021 in a better light. However, who knows what's going to happen in the next couple of months. So point being, if you do want to get that visit in by the end of the year, give my office a call. I don't think many people realize that I do what I do and I take insurance. If you don't have insurance, I think my cash packages are basically what insurance pays me. So I'm not charging $500 in cash for a visit to do what some would call functional medicine, when the reality is I'm just ordering a bunch of tests, and we're always going for the root cause at my office. That's what I do. So if you want to get your hormones checked, if you'd like to talk about endometriosis or fibroids, or I do have people coming into the office even. I had a lady drive down from Dallas today for an ovarian cyst issue that she was having. So, it's safe. We actually structure the schedule at the office so there's never more than really 2 people in the office at any one time. A lot of my visits, probably 80%, are telemedicine visits. So thank you so much for the kind words, Ms. Louise. That's very nice of you. Anybody have any questions now that I've mentioned that the visits and things are open? Any questions about Texas or COVID or the elections, because I'm an expert on elections too, and hormones, fibroids, any sort of questions that you might have about any female health, women's health topics. I'd be more than happy to try and answer as best I can without giving individualized medical advice. I'll say what I think I would do in normal situations, but anything anybody has questions on. Like I said, visits are open. I do have some slots available this week. Taking insurance, you just call the office, tell us what your insurance plan is. We'll tell you if it's covered. And if it's Essure, I still have a couple of surgery spots left before the end of the year. We can try to get these Essures out of you if you're having any problems with those. If you're having any problems with your fibroids, I can come up with a comprehensive plan ranging from medical management, surgical management, supplements, anything that you feel like might be in the spectrum of what you're wanting to do, definitely can help you with that. And realistically, what we know is that women on average tend to suffer with fibroids for about 3 to 5 years before they're really treated. Women with endometriosis average of 7 years of suffering before they actually get diagnosed and treated. Women in emergency rooms have much more time before they get pain medication than men. Do you think that you need to do some detox after Essure is removed? My personal belief is that your kidneys and liver were made to do that very job. And if you give them what they need, i.e. good hydration and good organic food with antioxidants, I believe you'll detoxify yourself. I don't think you necessarily need to do anything out of the ordinary. Although, taking a good, probably multivitamin, magnesium, fish oil, things like that's probably good too. I'll be rescheduling in February and March. COVID stuff and traveling for surgery made me leery. Thank you. Yeah, it's all about, you as the patient. Obviously, I would have been more than happy to do it anytime. And I do think that surgery is safe, although I can understand people that are not wanting to get on airplanes. Actually, I'm getting on an airplane on Thursday. I'm traveling to Phoenix to do some teaching. And I've been traveling all throughout this, wearing a mask and, washing your hands and doing the things you're supposed to do. And there's a lot of people traveling. Southwest has been really great about leaving that middle seat open. But American, I flew them a couple times and they're packed. The flights are packed. Trina is trying to get her son's nurse to see me. What is the difference between what I do, checking hormones, compared to an endocrinologist? She's been trying to get her pregnant, and her gynecologist isn't really doing much. I can't really speak to endocrinologists. I can speak to the fact that I have a lot of patients that see endos. Endos, I'm sure there's great ones and there's bad ones, just like there would be with gynecologists. I think that endos don't really focus on women's health. They focus on mostly diabetes, mostly sick people. They probably do a lot of thyroid, but they're very strict in the way they do things. Most of them won't do bioidentical hormones. And I don't think a lot of them are into different types of thyroid medications. Most like to stick with levothyroxine rather than using the combination pills of like NP thyroid or Armour thyroid. I just think it's just a little, obviously they're specific to the endocrine system, so they obviously know what they're doing. But it's kind of like, I look at it as more of like, if you have somebody that's in severe Addison's disease or diabetes that's uncontrolled, then you kind of need, you need a specialist, you need an endocrinologist. But if it's just run of the mill, they don't necessarily look at the balance of hormones. Many of them look at things as normal or abnormal. And the way I look at labs is, okay, it could be normal or abnormal. Now I liken that to being, you're either in the house or you're not in the house. Normal is you're obviously in the house, but you can be in the house in several areas. You can be in the basement, on the floor, which may not be the best place for you. You could be on the stairs in between the basement and the main level. You could be in the attic. So it really matters where you are in the house with relations to your hormones. And I think that endocrines most of the time just prefer you to be in the house. They don't necessarily focus on where you are as an individual. And as I have seen over the last 15 to 20 years, hormones are very bio-individual, and they vary, obviously, like I said, from person to person. So while somebody, to my analogy, who's standing on the stairs in between the main floor and the basement with their thyroid, they may feel awful. And if you just bump them up to that main floor, they're good as rain. Is that even a saying? Good as rain? It doesn't even sound. They're good as gold? Anyways. So you wanna just know where you feel better. And I can't tell you how many women that I have seen It depends, Sarah, if that's your total testosterone or your free testosterone. If that's your total, that's really low. And if it's your free testosterone, that's actually quite excellent. So you just need to know which number you're talking about. Lost my train of thought. But anyways, yeah, so get in. Second opinions are always, I'll do them all the time. I take care of a lot of people. Yeah, right as rain. That's what I said. It just sounds weird. Like, why is rain right? I don't, anyways. But thanks for telling me the answer to that. I can't even read anymore. Gotta put on my glasses. If that's your total, Sarah, that's not even in the normal range. I didn't even know it came back. Like, usually it just says less than 12. I didn't realize 5 was a reportable number. But anyways, if that's the case, that is really low. So, but a lot of doctors, even though it might be 5, which is low, you could multiply that 11-fold, and in most labs it would still be normal for a woman. Most doctors don't even think that that's something they want to deal with. They don't think it's like low testosterone in a woman like that is going to feel like you're going to have fatigue, but it's especially in the afternoon, 4 or 5 in the afternoon, you're hitting the wall. I've often joked that low testosterone, if it was a T-shirt, would say meh. You just don't care. You'll do it, but you're kind of like, yeah, whatever. I can take it or leave it. And it's that way with sex. It's that way with hobbies. Things that you just normally would like to do, go out on a hike or go to a movie, and you're just kind of blah, whatever. But you're especially tired in the afternoons. Testosterone is very important. It's, I think, just as important to a woman as it is for a man. So don't let people tell you otherwise. So any particular questions about hormones, Essures, fibroids, endometriosis, pelvic pain, the elections? Yeah, I just got to throw that one in there. I will go on record as saying that I did not vote for either person because I just think the whole thing stinks personally. I couldn't. It's like eating something that is knowingly going to make you vomit or hitting your thumb with a hammer. Maybe somebody would find an easier choice. I personally could not figure out which one was going to be less painful. So I know that's probably shrugging my. I did do a write-in candidate. Unfortunately, John McCain is dead. So he didn't win. But yeah, I'm available. We've got appointments available. We've got a couple of surgery spots still available. So if you were on the fence, not thinking we were going to have time, get in. You never know what's going to happen. Your deductibles might be lower than they will be starting in January. And so let's get you seen, or let's get, the Essures removed if that's what you've been thinking about. And we'll see you when you can get out here. So I'm going to clean up the kitchen because that's pretty much the excitement of my life. And I'll talk to you all later. Bye.